Welcome to the Mom and Mind podcast. I am your host, Dr. Kat. On our episode today, we're having a really interesting discussion about how we feel through life. And what I'm talking about is specifically what happens to our nervous system during stress, specifically during the transition to parenthood. And we're talking with BG Mancini, who has 25 years specializing in physical and neurological recovery in children with challenges and working with all members of the family to recover what she calls the family nervous system. And it's a really interesting discussion about like co-regulation in some ways that what's going on for our nervous systems in our family system impacts one another. I'm really interested in particular about the discussion around the vagus nerve and what that is in our body and how it impacts how we feel and how we function as we are learning to interact with our babies. BG Mancini is a licensed acupuncture physician and practices as a primary care provider by telemedicine. Her focus is in functional medicine and nervous system resilience, working with children and families to identify the root causes of physical, emotional, and neurological challenges. She uses a lot of different tools to strengthen family connections. She's going to tell us about one of them called SSP and how she uses those tools to bring back joy to parenting. The premise of her work is if we are not feeling good in our own brains and bodies, we are unable to deeply connect with ourselves or others or even our children. So thanks for tuning in to this really interesting discussion. Let's meet BG. Welcome, BG. I am so glad you're here. I'm really excited to start our conversation today.
Thank you, Kat. I'm happy to be here.
I think the information that you're going to share with us today might be totally brand new in terms of a concept or anything like that, and also super duper important. So I'd love for you to talk a little bit about what you do and how you do that, and also how it's connected to perinatal mental health in general, just to start us off.
Okay, great. So I work with children and families. It's something that I call the family nervous system. And I do that all by Zoom. And what I do is a lot of times my little patients, the pediatric patients, are the ones that come to me first.
Mm-hmm.
And through an evaluation, through different either blood testing or gut testing, or some evaluations that I do by Zoom, we find out, what's going on with them. But then as I talk to mom, sort of what helped me to create the family nervous system was, I'd be talking to mom and saying, okay, here's what I think we need to do with your little one. And, moms are basically designed to be PTSD from the minute that our children are born, because we are designed by evolution to hear beep 2,000 square feet away.
Mm-hmm.
And so our nervous systems just in general are that way in fight and flight. And then when we have children who have any kind of challenge, then we are going to be even more amped up. And all of a sudden we see the moms go, yes, I am amped up and I'm not sleeping and I do have digestive problems and I do have
Right.
this and I have an autoimmune disease and I have this. And so, then I started to sort of piece together because, part of what we'll talk about today is the SSP program and the vagus nerve.
Mm-hmm.
And we used to use that with the children first to help shift their nervous systems. And what we learned over the past couple of years is that when we even introduce that to moms first, it's an auditory listening program, it's 5 hours long.
Mm-hmm.
Then the children started to shift already. Even
Mm-hmm.
before we got the music on them, they became more engaged with the parents, they calmed down, they felt more cuddly to the moms. So, it was just really beautiful how by integrating the healing, together through the family, it's not just one individual, it's not just moms, it's that feedback loop between our children because moms' nervous systems rule the roost.
Fascinating. There's so much in what you were just saying that I think I'm really excited to dig into. Can you talk a little bit more about what you mean by assessing the gut and assessing the other types of assessments you do, the vagus nerve, and what that's
Mhm.
all about?
Great. So It's become much more common knowledge now that our microbiome is integral to our mental and emotional, neurological, and our hormonal health. Because, for instance, and I do this with with parents and children as
Mm,
well.
mm,
So let's say we take a stool test, right? There are certain markers in there that can show us, for instance, there's one called beta glucuronidase. No need to follow that or spell it. Just here's what it does. It's really fascinating. So it's a molecule that actually causes the uncoupling of toxins and estrogenic molecules. So now, if that happens, everything that we're supposed to be getting out through our gut, all of our toxins and the high estrogens and the estradiol, is now being recycled back up into the body. Well, as a woman, that's like the worst possible scenario. And
mm,
since we all have a tendency towards leaky gut, number one, as we get older, but also if we're eating a standard American diet. So now all those hormones are getting recycled again. And it's dirty estrogen, it's not the helpful kind. And those toxins and pathogens and food particles are going back up. So from my mom perspective, that's where the gut testing really becomes critical. And then for children, I have a lot of moms who bring their kids who say, my child is complaining of stomach aches,
mm,
or for little ones, it's kind of a running joke, but it's not funny. I tell parents, children are not Metamucil deficient,
mm,
which means if your child is being given Metamucil, especially as a baby, it's not because, oh, it's just a little constipation. It's likely that we need to restructure and support their microbiome, or they're having food sensitivities and it's resulting in constipation.
mhm. Wow. So, right, not only like what you were saying before, you're looking at the family system in terms of how people are being affected, but you're looking at each individual person's system with these markers as indicators of what's going on, as opposed to just, I would say, what like conventional medicine might do is just mm, um,
A
uh,
Band-Aid.
a Band-Aid, right? Give the Metamucil.
Give the
Why are we?
Metamucil, right?
So you're talking about why do we need the Metamucil?
Right.
Or why is that a need? Yeah, super interesting. Um, can you talk a little bit more? You named a couple of things: the vagus nerve and also the SSP
Hmm.
um, programming. Yeah, can you
Sure.
say a little bit more about what those are?
So the vagus nerve is what runs through anywhere between 80 and 90% of our organs, the entire body, from brain into our enteric system, which is our gut. And when we talk about trusting our gut,
Hmm.
that is literally a part of our nervous system. So when we get those tingles and when we get that feeling, that is your nervous system actually responding. It's called interoception. It means you're feeling
Mm,
and you're sensing what is happening inside of you that is giving a cue of safety or non-safety. And so the vagus nerve, part of the work that I studied is the polyvagal theory by Dr. Porges.
mhm,
Brilliant man, love his work, and that is who created the SSP. And so through the polyvagal theory, what we learn is that we are constantly scanning our environment for cues of safety or non-safety, right?
yeah,
Threat
yeah,
assessment.
yeah, yeah.
And so if we look at, there was a great book written, I don't know, 10 years ago called Zebras Don't Get Ulcers.
Yes.
Okay. So the zebra gets chased by the lion, cortisol goes crazy, they dump their bowels, they're stressed, they escape. They get to the watering hole. They don't need 3 years of therapy to get over the chase. They're
Mhm,
like, "All right, physiology, calm down, drink my water, go on with my day."
mhm,
Whereas for us, little trauma, little T trauma and big T traumas can affect us in a way that the body remembers.
mhm,
And so the vagus nerve, like a rubber band, oh, I have one here. So our
mhm,
vagus nerve,
mhm,
little T trauma, that can be something as benign as your little brother jumping out of the closet at you in the dark.
mm.
And that stuck with you as something that really stressed you. And then little more traumas and environmental exposures, food sensitivities, parental distress, environmental stuff. And then the vagus nerve gets less resilient and now it's a loose rubber band. So the signals are
Okay.
not sending from the gut to the brain as effectively. So that's just
Interesting.
one aspect of the vagus nerve, in addition to the fact that it can have infections affect it,
Mm.
that it can have environmental things affecting it as well, nutritional deficiencies. But what the SSP has allowed us to do, the SSP is called the Safe and Sound Protocol.
Mhm.
And it's a 5 hour, it got actually made into an app, which is amazing because at
Oh.
COVID, first we just had physical units
Mm.
and we had to work one on one that way. But because of COVID, they were able to pivot so quickly and we're able to turn it into an app. So now we can work, worldwide with clients. And so it's something that you listen to that communicates directly through the middle ear, where the vagus nerve branches off on the left side.
Oh,
And
okay. I was wondering where it
yeah.
is exactly.
Mhm.
So thank you. Yeah.
And he describes it, Dr. Porges describes it as cues of safety, as if it is a regulated mother communicating to an infant.
Mm.
So imagine the nourishment that it would feel in your body to have a regulated mom cueing into an infant, and sending those safety signals.
Mhm.
Because our bodies and our minds are actually designed to help us survive, of course,
Yeah, yeah.
but we take in everything as if it's a threat
Mhm.
unless we are cued into a cue of safety. So
Mhm.
this helps us to scaffold our nervous system in a way that we can start to identify accurately, is this a threat? Is it not a threat? Am I
Mhm.
safe?
Mhm.
Can I experience safety? Am I allowed to just do that and give myself that space?
Yeah, as you were describing that, I was thinking of so many of um, the actually anybody on their reproductive journey and how many things could potentially be traumatizing along the way, and or things that are people are dealing with now as kind of leftovers from the trauma they did experience. A lot of times that being like a birth related trauma, and how to your point, like scanning the environment, I feel like that's one of the most vulnerable times someone can be in is in like giving birth, and um, it could potentially be a very safe environment, but if it's not feels like a safe environment, that could feel really vulnerable and very threatening. And you're bringing in this brand new person into the world that you've never met, and all of the stuff is getting kicked in to be that vigilant um, mother. But if there's also trauma associated with it, it goes well past hypervigilance into a state of like everything is terrifying. People can feel really paralyzed. So I'm thinking of what you're describing, like if it works the way it sounds like it works, the vagus nerve, I'm sorry, the SSP program is how much comfort and relief people could experience from being able to distinguish safe from not safe.
It's so true. And we were talking a little bit before. I can share from working with PTSD soldiers
Mm-hmm.
who haven't slept, experience chronic, severe pain, severe PTSD. I mean, within a month, they start sleeping. I mean, much shorter than that, but the program was finished within 3 to 4 weeks. Um, and I said to the last one, I said, so how's your pain? And he said, it's about the same. And I said, okay. I said, well, how about exercise? He's like, well, I'm exercising every day and running now. I'm like, but your legs were giving out before. He literally couldn't drive a car because his
Oh
pain was so
no.
severe.
Oh
And so he's like,
gosh.
oh yeah, I guess that is a lot better.
Mm-hmm.
Our
Mm-hmm.
threshold, our window of tolerance. I'm sure
Yeah.
it's like we think our 10 is here, but then the next day, even though that symptom is better, we still think we're at a 10 because
Mm-hmm.
when our threshold is just so non-resilient, everything kind of feels that way. But he was
For sure.
sleeping, he was exercising every day again. His digestion had improved. And when I work with moms, it's funny, they'll say, yeah, my husband is suddenly less annoying and and I'm not as reactive to my children,
Uh-huh.
and how much of a grace does that give our relationship with our children when we are not as reactive? And part of what we learned during COVID, if this is where the human experience happens. It's when our smile meets the wrinkles in our eye, these
Mhm.
muscles here, okay?
Mhm.
This is actually how we convey cues of safety to each other.
Mhm. Mhm.
And there's a difference, my one of my kids, he was I think 5 at the time. Those buses that go by with the big faces for like law firms or whatever.
Yeah, yeah,
They
yeah.
must have photoshopped out any wrinkles here and any wrinkles here.
Uh-huh.
And so he just looked over and he said, "Weird, mom. I don't trust that guy. Look, he just looks like he's baring his teeth at me." And that's exactly the
Uh-huh.
difference in evolution, that we
Mhm.
communicated this way. It's not just baring our teeth when we smile. So
Mhm.
imagine what the kids went through,
Oh,
when they
right.
went through the masks.
Not being
They
able to
had
see
no
those
cues of
cues.
safety,
Mhm.
and the trauma that our families went through and the parents were in, and the lack of being present that we were able to feel and to give our kids and our babies and our toddlers and our whomever at that time. It really
Mhm.
affected everyone's nervous system. And we are seeing increased delays, increased diagnosis in kids that are under 5 who went through that. So it's pretty profound how the SSP can help.
Yeah, I've seen that specifically with clients that I've worked with whose kids were born either very like right before COVID and the shutdown or during, and how much more difficult things had been socially for families who
Mhm.
were a little bit more isolated. In part, I believe what it's connected to what you're describing, just not being able to have interactions with people. Certainly within their household, they were felt fine and safe, but anybody outside, they
Mhm.
had such difficulty reading cues,
Yeah,
being able to know that they were okay, feeling more clingy, and rightly so. They don't know how to read people's cues.
right.
This the SSP for kids, you're saying, is also like the program works for adults and children.
It does. Yes, we have 2 different music, lists, although some adults like the Disney kid one and some of the kids like the adult '90s music that they have. So we have 2 different playlists, and, it used to be when it first came out, which was right before a year before COVID or so, we thought it was 1 hour a day, 5 hours, 5 days in a row, and that's how we were doing it. That's what we were given as instruction. But over the years, those of us who have been doing it and therapists from all over the world, we have learned that we prescribe the music now. So it might be 15 minutes to start and see how your nervous system processes it. How do you feel the next day? Great. Okay, let's keep going. Another 15, 30 minutes. Some people do it 30-minute sessions just straight. I'm someone who I work with a lot of very sensitive adults and children.
Mm,
And so I
me
like
too.
to, yes. And I may be one as well. I am
I
someone who
am.
has a very refined nervous system. I like to say, I don't like to say super sensitive, but I definitely interpret things in cues of safety differently than a lot of people do.
Mhm.
So I like to help people in that stage where, hey, let's just go low and slow. It's how I do supplementation. It's how I do everything. So let's let your nervous system determine. And with kids, I mean, I've worked with many autistic children, and they actually they go from this, shut in, to being able to be engaged with other kids. That many of them become verbal and start speaking, and
Amazing.
we use other tools in the functional medicine world that I have that also support that. Because a lot of it is not that they don't know how to speak, it's that their nervous system is telling them it's not safe to be out here. And
Mm,
so cueing it, it's not a logical thing, it's just how the brain is patterned. They're
sure.
not thinking, I don't want to speak. It's just once they get those cues of safety, then it starts to scaffold their brain in a way that they're able to come out.
Mm.
And even kids who have, radical attachment disorder, ADHD, and then pretty much anyone with a nervous system. My kids don't have a diagnosis, but I do use SSP on them once a year just to make them more resilient. The world's overwhelming because children are
Mhm.
very, very sensitive. Children's nervous
Yes.
systems are undeveloped, and so that's why, especially as infants and as children, young toddlers, and then even 5, 6, 7, 8 years old, it is a building of their nervous system
Mhm.
by the cues around them. So
Mhm.
if we are dysregulated, even if we're smiling at our kids, but we're feeling totally crazy, and if you took a sound test of what we sounded like, it would be,
Mhm.
you
For
know, so
sure.
our kids, they receive that information. It is not an intellectual process. They are just, that is the feeling they are getting is this dysregulated shriek. So, when moms talk about, oh, I know I need to do self care, I try and help them turn it around as this is not self care. We're talking about you caring for your children by taking care of you and your nervous system and your well being, because you can only give your children and you can only expect to understand their needs so far as we've met our own. Because if we're still up here in our heads, we're going to have what I call a relationship about our kids instead of with them.
Mm. Ooh. Yep. That is really real. I'm just like, as you're talking through it, thinking of all of the implications, and just in terms of how the mothers I meet, especially ones that are dealing with depression or anxiety, or having difficulty in transition into parenthood, is it's so often that they have, how can I say it, um, they connect, or they have made a connection around how good of a mother they are with how they feel about and or towards their kids, or how their kids are responding to them.
Mhm.
And it's not what I think is super important about what you're describing is that it's not like you've just decided to sort of quote unquote be this way or behave this way. There's something really going on for you that is impacting the way you function and the way you interact. It's not just, I should just be a quote unquote better mom, or I should, I should be able to snap out of it. And like really addressing that there's something impacting you, and the way you're functioning, and the way you're interacting with people is real.
I don't share this story often, but considering the people that you help, I'll tell you that I had a super traumatic second pregnancy. I had an
Oh no.
undiagnosed sinus infection,
Oh,
so bad
oh,
that I had to wear, leggings up to here, and I couldn't walk from one room to the next, and
oh my
it
gosh.
was horrific. And in anticipation of postpartum, I even went to a psychiatrist ahead of time because my husband was like, "Please just have someone on standby in
Yeah.
case." And
Yeah. Oh yeah.
well, you don't know you're in it until sometimes you're out of it, right?
Mm-hmm.
And it's funny, I watched, a show called This Is Us.
Yeah.
Not necessarily highbrow watching, but I was watching it one night, and she says to her husband, "I am not okay."
Uh-huh.
And it was like the biggest palm just went to my head. That's
Yeah.
all I had to say to someone was, "I'm
Yeah.
not okay."
Right.
Instead, what I did for the next, like, 2 years was white knuckle it, you know?
Mm.
And I
Yeah.
white knuckled
Yeah.
it, and I
Yeah. Yeah.
every night when I had to know that I had to get up and make sandwiches the next day, or, whatever it was, everything felt so darn overwhelming.
Yep.
And, I had some help, I had someone come in and, help me assess my kids, make sure they're okay, but I did not have anyone come in and assess me. And so, I'm speaking from a lot of experience when I talk about, if you had added one more thing to my plate,
Mm.
such as a child with behavioral or significant learning disabilities
Mm-hmm.
or significant health issues,
Mm-hmm.
I don't know how much more that would have impacted me. But I would
Right.
love to just share that, the order of operations here is this.
Uh,
If you are struggling with postpartum or any kind of anxiety or stress and you have children, I really think that the first thing to do is get an assessment based on your digestion, your neurological health within your gut. What signals, what are you eating that's causing crazy inflammation in your body? Because anything that has an itis at the end of it or autoimmune is all inflammation.
mm-hmm.
Inflammation comes from what we are eating, toxic things we are exposed to, toxic people, and stress.
Mm-hmm.
So, if that is a part of your everyday, what can you do on the daily to reduce the inflammation in your body and brain? because we have what's called brain on fire. Anxiety and stress disorders are brain on fire. You literally feel like at the top of your lungs, right? But you
Oh,
can't let
yeah.
it out.
Right.
So I would
Right.
say get yourself, look at what you're intaking that could help reduce, inflammation. Then once that starts to calm down, our children are going to react and respond differently to us. And if you're not getting the information you need about your child, and your child is clearly struggling according to you, because you're
Uh,
mom,
yeah.
moms know, all
Yep.
right,
Yep.
then reach out, find the right help. We are a resource for families, even if we don't feel we can help. We
Hmm.
take everyone
Hmm.
on a case by case basis. If we're not the ones, we like to help families find the right person and right resource. Because if it were not for the fact that I had colleagues that I could call,
Right.
my 8 month old, the one that came out after that pregnancy,
Oh, yeah.
at 8 months, here it is, this is what I do. But I could see one hand was not equilaterally crawling, one
Mm.
leg was left behind. And these are all what's called crossing midline in the brain. So he was delayed. I could see it happening. Sweet as pie kid, slept, all that. But crawling matters, movement matters,
Hmm.
mobility. And if I couldn't call my friend and say, hey, what are you seeing? And she said, I see what you're seeing. What do you want to do about it? You
Right.
know?
Right.
And then I had them to help me. Then I would have had a delayed child instead of a few corrections here and there, and we got him moving again and everything's fine. So I really feel for everyone who goes through this because I was there.
Yeah. Yeah. It's brutal. And it's hard to understand the magnitude of it, how it impacts you, and unless you're in it, um, or unless you're a sensitive person and can like deeply empathize or sympathize. But but even with that, I'm going through something like that. And thank you for sharing, by the way. I mean, you are speaking to the people who get it, and I'm one of them as well. I suffered greatly. Um, it it is sort of unfathomable how horrible you can feel, and at the same time, it is astonishing to me how uh, how people keep putting one foot in front of the other, even when they feel like the worst they've ever felt. They keep like trotting through, and trying on behalf of themselves and trying on behalf of their kids, even if they don't know the answers,
Mhm.
or how to feel better. It's amazing that both of those things can exist at the same time. You can feel that bad and keep moving, but people do. Um, what I'm curious to know, let's say for people who are listening, they want to experience this SSP type of a thing. You had mentioned before it's like some music or sound cues. This isn't just people like listening to something off of Spotify or whatever. It's not
No,
just
thank
listening
you.
to music.
No, no, you're
How do
right.
people, how can people access this or feel better? Or if they can't, let's see, like don't have access to somebody like you, where could they go to get this kind of help?
Well, the great news is that it's an app now. Thank you to the company who created it.
Hmm.
So, everyone can get it. It can be downloaded to your phone.
Mm.
It's just a matter of, reaching out, doing an assessment. And then again, I have many different therapists who I work with who, if, depending upon what type of issues people are dealing with.
Mm.
So, just by reaching out to us, we can get you to the right person and
Mm.
get someone who works with, because some people have different trauma backgrounds that require a specialist in that.
Uh-huh.
And
Yep.
some people, if it's postpartum, like I want it to be a mom who works with you so they understand, the
Mm.
dynamics, because a lot of the work, so the SSP, even though it sounds like regular songs, it's the frequencies that have been shifted by Dr. Porges that create those
Oh,
cues of
oh,
safety. So
oh,
it might
oh.
sound like Disney music for kids, or it might sound like Sticks, or like different songs from the '90s for us.
Uh-huh, uh-huh.
Um, it actually, that you'll hear in the listening, it goes up a little bit and then it gets very quiet because it's training the resilience. It also helps to decrease sound sensitivities, which
Oh
so many moms have,
my gosh. Are you
right?
kidding? That's a huge,
Yeah,
massive,
because
massive. Yeah.
even small sounds, or if it's a repetitive sound, we
Mhm.
get triggered because
Yeah.
it's telling our nervous system has adapted in a
Mhm.
way
Mm.
that it is heightened and everything is bothering our brain. It's like nails on a chalkboard in your brain when you have the sound
For
sensitivity.
sure.
So this is something that also helps to retrain your ear to not feel as reactive to those
Mhm.
sounds.
Right, so not like you won't hear them anymore, you just won't have the response.
Right.
Right. I'm thinking of like moms who are anxious and who would be worried that they wouldn't be able to respond to their kids.
Oh, no,
And
it
what
doesn't change your hearing. I mean, it
right.
doesn't change your hearing. What it does is it helps to filter out the sound. We are responding to, for instance, the low growl of an animal.
Mm,
We hear a low sound, sometimes certain men's voices for women, okay, or for
yes.
children. Low
Yes.
sound growl, low on sound frequency causes our nervous system to go, what is that? Because that's what kept
Totally.
us alive through evolution. So what
Yep.
this does is it filters out the highest and the lowest and gives us cues of safety. And then what it does is it tells us that the cues of safety range are not threatening us. That's all it
Mm.
does.
Mhm.
So because
Mhm.
we are now fight flighting and interpreting scare and fear and aggression
Right.
in faces and sounds that are not meant to.
Yeah. Ooh. Wow.
It's
That could help
profound.
so many people. So many people. It's interesting too because I think like let's say for the more anxious moms or people who've been through trauma and are more reactive to certain cues. Specifically, let me go back to some moms with anxiety who might be so used to responding to their children in an anxious way,
Mhm.
and that feels like protection. Um, and it might be. I'm not saying it's not sometimes, but it always feels like that. If every cue that you hear, it gets you feeling like, oh my gosh, I gotta get up. I have to. What's happening? Like that. Um, they some moms start to interpret that they or perceive that they need that kind of response in order to attend to their kids. Um, it's really hard when with somebody who's feeling anxious to help them understand that they don't have to be anxious to respond.
Mhm.
And it sounds like this might be an avenue.
It is because you cannot, not you, you can't
Yeah.
do anything. I cannot, we cannot
hmm
think our way into safety.
Right.
We cannot explain. You could not have explained to me when I was anxious as all get out because
Mm.
I really had just exited stage right, and I was
Yeah,
just
yeah,
living
yeah.
in this really heightened, anxious, crying for no reason space, right? um, that, hey, there's safety on the other side of this wall. Like, I don't know
hmm
what safety feels like at that moment. I don't even know, it reminds me of there's a Buddhist parable that I used to think about. I just want to share this. So the Buddhist teacher is sitting in the balcony of a theater and watching a movie, and the student is off to the side behind the curtain. The student cannot see the screen. The student sees the light on the face of their teacher and knows that the light is there, right?
Um,
So the reason I share that is because when someone's nervous system is so anxious and so stressed and they're lacking joy in their parenting experience,
mm,
which is really why I do what I do. I want to
yeah.
return that, joy of motherhood, joy of being a kid with their mom, in those family dynamics. You can't it's not possible for a nervous system to comprehend in that anxious state what not feeling anxious is. But when you
Right.
give them cues of safety, when you use somatic experiences like massage, acupuncture, craniosacral, EMDR,
hmm
SSP, these tools that allow cues of safety to be experienced from the inside out, not
hmm
through the intellectual brain,
Right.
then they're like, oh, wait, I I sense this. I feel it. This is truth in my body and brain.
Yeah.
Then it starts to help them navigate differently.
Oof. I'm gonna have to try this.
It's wonderful.
myself. I'm like,
Everyone
I could
uses
use
it.
that. I've been through some things.
Right. We
Um,
all have.
and even what I find to be interesting is, and I'm curious, just from a personal perspective too, is even if we have experienced a certain amount of healing through our own trauma, there could still be little bits in there that show up from time to time that you don't expect. And I hear people say this, well, I thought I dealt with that. I thought it was done, but now you're in a new scenario, a new situation, and some of that is coming back up a little bit. So I'm like, maybe I should try this.
Bessel van der Kolk, right? The body
Yep.
keeps the score.
Oh yeah.
The body is just retaining. It's like a memory, just folded layer over layer over layer over layer, and there it is
Mhm.
again. And now it's
Mhm.
hitting. Then it connects to this thing, and it's a constant evolution for me for
Right.
healing.
Right. I That's important. Like it doesn't necessarily end. You don't get to some mountaintop or whatever and you're just done. Life is life, and stuff happens. Um, so I'm curious with with specifically with the work you're doing. I know you said there's an app, and so it sounds like people could do some of this on their own, but there's also all of these other parts to of what you do.
Well, so the SSP people can't do on their own. What that means is that they
Uh
would
huh.
contact us, we would do an intake,
Oh, I see. I
and
see.
yep, and then we send a invite to the app when they're
Mm.
then allowed to download. And
Mm-hmm.
then we make sure that the communication is open so that they understand today you're only listening for this much. Some
Oh,
patients have been so challenged with either brain fog or long haul COVID or anxiety,
oh my
they have to
gosh. Yeah.
turn the dashboard off because they can't keep track of their own stuff and they might listen too much.
Mm-hmm.
So so no, so that's the type of thing that we do with SSP specifically.
Mm-hmm.
The other work that I do, everything is done by Zoom,
Mm-hmm.
and I do intakes for children. I've worked with babies in the NICU. It's just a matter of if there's a neurological, emotional, behavioral, um, any type of disconnection from our own body. Because when I don't feel well, I check out.
Mm-hmm. Mm-hmm.
So if I am feeling anxious, pain,
Right.
digestive discomfort,
Yeah.
stress, you know, as a human, I'm going to watch something, pick up my phone, eat something, do something that's going to change the way I feel.
Mm-hmm.
If I do that, I am no longer in a position to parent my child genuinely in the way that I want to because I'm not even in my body.
Mm-hmm.
Right? And so
Mm-hmm.
how many moms are walking around now with triggered autoimmunity and Hashimoto's and digestive issues and not sleeping and all of these other things, um, and then checking out because that's how we survive. We cope,
Totally.
by getting out of this situation that
Mm-hmm.
feels so uncomfortable. But in order to, to be present and enjoy our children, we have to find a safe and comfortable way.
Mm-hmm.
Safety, safety. It's not
Mm-hmm.
like, okay, quick, I'm going to just jump back in my body and grin and bear it. It's how can I safely process through my health issues, through my sleep issues, my
Yeah.
neurological, my anxiety, so I can enjoy the motherhood experience, and allow my children to receive the benefit of my healthy nervous system.
Sure. Sounds really powerful. So where can people go to learn a little bit more about, all that you're describing?
I invite everyone to take a look at our Instagram. We put a lot of information up there on mothering and parenting and being an adult and how to function in this world. And it's
Mhm.
at Brain Gut Institute. And then our website is braingutinstitute.com. And I also do have a free 30-minute course for parents to look at for um, managing children under 2 and 3 and their nervous
Hmm,
systems and food sensitivities.
hmm,
And then, there are books that we can also recommend, like Zebras Don't Get Ulcers is a
mhm,
great one.
mhm,
And if you want to just Google Dr. Porges
mhm,
polyvagal theory
mhm,
or Dr. Porges PORGES
mhm.
SSP program, you'll hear so much about your nervous system that you never knew that
Mhm.
is so beautiful. And he's such a regulated individual that it's a pleasure just to sit and listen to him talk, as far as I'm concerned.
That's awesome. Well, great. I thank you so much for this. It's so enlightening, such a great conversation. It sounds like a really, really amazing resource. I appreciate your time.
My pleasure. Thank you for having me.
One more time, if you'd like to get connected with BG, go to braingutinstitute.com or Instagram and Facebook at Brain Gut Institute. I hope you found this discussion as interesting as I did. Thank you for joining us. Until next time.